The spinal cord is continuous with the brain and begins at the foramen magnum of the skull. It extends out from the medulla oblongata and ends around the L1 or L2 vertebra. The vertebral column of adults is longer than the spinal cord because it grows for a longer period of time than the spinal cord. There is a gap between the end of the spinal cord and the vertebral column. As the spinal cord begins to end, it begins to taper off, and this place where the spinal cord ends is referred to as the conus medullaris. The spinal nerves exit the vertebral column through the intervertebral foramen, which are between adjacent vertebrae and formed by vertebral notches, or they exit through the sacral foramen, except for the C1 vertebra. This is important for the spinal nerves leaving the vertebral column to reach more peripheral regions of the body. The C1 spinal nerve exits between the occipital bone and the atlas. Spinal nerves C1 through C7 will exit superior to the same number vertebrae, while the C8 spinal nerve exits inferior to the C7 vertebra. After this, spinal nerves T1 through CO1 exit inferior to the same number vertebrae. The spinal cord becomes more narrow and smaller as it begins to end. The conus medullaris is the final segment of the spinal cord that is tapered in comparison to the rest of the spinal cord. Cauda equina is also known as the horse tail. It is an extension of nerve roots from the conus medullaris. These nerves reach down to extend to the structures that they innervate, which are lower than where the spinal cords end. The spinal cord is protected by the meninges. When the spinal cord ends, the vertebral column does not, and these protective meninges do not end as well. In this area, there is CSF in the subarachnoid space. This has great clinical significance. This gap is where CSF can be extracted in order to be measured and not damage any neural structure. For adults, it is important to insert the needle midline between L3 and L4 vertebral columns to access this lumbar cistern of CSF. If you insert the needle higher, you will hit the spinal cord and will cause damage to the patient. The needle will pierce through layers of the meninges, including the dura mater and arachnoid mater, and will also pass the cauda equina. A sample of just a few milliliters of CSF can be withdrawn from the subarachnoid space and tested. Normal CSF is clear.